This is Sunnee Serotonin. Joining us is
Sewell. I'm a clinical health psychologist and associate professor at the University of Kansas Health System.
as an introduction, what made you choose your profession?
So weirdly, it was actually a high school debate initially. I loved back then learning everything I could about a topic each year and then kind of being forced to rapidly assemble like an argument in the moment. And that really worked well for health psychology, where I feel like I get an hour to learn everything about the patient's like medical condition, mental health, and other life factors, and then try to piece together all of that into a puzzle that I get to try to start solving.
What are the subtle early warnings of suicide that friends or family might miss?
Yeah, I want to start by saying that there might be none in a lot of cases. Suicidal behaviors can be highly impulsive, and they don't always have clear signs. I think this is really important because family members and friends who have lost someone to suicide can really struggle with guilt and kind of replaying what they might have missed, worrying about that. And sometimes there's really nothing. That being said, I think mental health issues are the signs that we should watch out for. I think things like withdrawing suddenly from family and friends, changes in mood, like emotional reactivity, like moodiness or flatness or irritability that's new for somebody, sleeping a lot more, sleeping a lot less. I think a significant risk factor is bullying or substance abuse. I think a high risk time is after somebody else that they know has died by suicide. It's some examples.
Is it true that asking directly about suicide can put the idea in someone's head?
So I'm glad you asked that because no, we actually know quite confidently that this is distinctly untrue. This is wrong. We find the opposite usually. So what we find is that open communication actually leads to much better outcomes. So it's actually really important to be really direct when asking about suicide. That way you avoid any accidental implication that you're scared of the answer if it's, too severe, too hard to deal with, or that you can't handle supporting that person. Or even that you think that it would be shameful if they said yes. You want to make sure you're not accidentally communicating that. So you want them to feel really safe to open up to you. So with my patients, I'm very straightforward. I'll try to get it kind of the urgency, but I will just come right out and say, are you at risk of hurting yourself today? Or have you recently thought about harming yourself? And I find when I ask it really directly, they just answer it as matter of factly.
What does a suicide safety plan look like, and how can we help someone create one?
Yeah, so safety plans really, I kind of think of them and talk to my patients about them as a more like collaborative guide that will be like right in arm's reach in a crisis. So when people are feeling really overwhelmed emotionally, our brains do not solve problems well. That is not a good time for us to figure out how to make ourselves feel better all by ourselves. So this has everything helpful all in one place. So might include the people who you trust to reach out to in a crisis, who hopefully know that you are their person to reach out to in a crisis, hotlines and emergency numbers, some distracting activities that they might try that also might activate their protective factors, like pet your dog or meet up with your friend or go to some extracurricular activity that you know you love or make dinner with your family. It also could remind people of what their own red flags are for starting to worry things are changing. It can have helpful mantras that they like or personal values, like reminding themselves of components of their spirituality or the people that would really miss them. So it can be really super personalized. Sometimes I even put in there that that they agree that there's a certain person who could check in with them more regularly on how they're doing and asking if they're suicidal. And then I include that person in the discussion. So we make it a really personalized plan they can carry with them.
What are the most effective evidence-based treatments currently used in Kansas to treat suicidality?
So I think the blunt first truth is that there's no effective treatment specifically for suicidality. I think it's too often unpredictable and impulsive. And I bring that up now just because I want to make sure people know that I don't think we have the kinds of research and solutions where where we know the answer to that question and where that should be the ultimate goal. I think the goal should be to reduce mental health issues, to help people manage the big stressors in their life and treat the disorders that come out of that. Improve the coping skills that they might have, especially starting early, like in childhood, focusing on those things. When someone's really actively suicidal and imminently at risk of hurting themselves, we, of course, use short-term hospitalizations to kind of urgently protect them physically, but that's not really treatment. Like, that's just kind of hopefully stabilizing them through the crisis. We want to prevent suicidality by treating the broader mental health problems like depression. We want to teach coping skills, teach people to kind of navigate like really highly distressing moments when they feel overwhelmed by their feelings. We want to teach them how to ask for help, how to identify their own changes in mental health, target bullying, substance abuse. So I think our efforts to prevent suicides should really include focusing also on the risk of suicide. So asking them, how are you doing in an ongoing way? Asking if they're suicidal, like I just said earlier, but also maybe asking them if there are items in their environment that we should remove to keep them safe. That is an evidence-based way to reduce suicidality, is to say, like, are there things you've thought about, pills or guns or knives that you think we should take out of your space? That is one method.
How can schools, workplaces, and faith communities in Kansas foster better mental health dialogues?
Yeah, there was a study recently that found that in adolescents and young adults, especially, if we increase a given state's mental health services directly, that reduced the rates of most types of suicide. So to me, the answer is clear that it's facilitating access to comprehensive mental health treatment when it's needed for somebody. That's the best option that we have. I think the longer answer is that we need a bigger workforce. We need more school programs. We need to graduate more people. We need to hire more people. We need to prioritize funding for paying for people with this training. I think in the shorter term, we need to use our community pathways like schools and work and places of faith to destigmatize and make available really good quality resources for people to figure out how to access mental health care. So I think that could be like handouts where people know where to go, or know warning signs, or even like educational opportunities, schools or churches, synagogues, or mosques, or community like county centers or city centers bringing in speakers with free information about mental health that can be given to the community. I think those are great ways in the short term.
Are there specific demographics or occupational groups in Kansas that show higher suicide rates?
Yes, it definitely show higher mental health rates and also suicide rates. I think rural areas are at higher risk, as are specifically occupationally construction type jobs and agricultural type jobs, veterans. In these areas and in these occupations, there's often specific factors related, such as those areas having low access to kind of preventative mental health care or early access mental health care. These are also tend to be high stress jobs. So ones that are going to involve, a more unpredictable hours or pay, where the people are more exposed to accidents or on the job or injuries, or observing really, horrific things like that happening, as well as really heavy physical labor and high burnout rates. So I will say though, I think the best thing to have come out of the pandemic from my perspective is nationwide access to telehealth mental health care. So more than 40 states, including Kansas, is part of a collective where you can see a provider on telehealth from any state and be covered. So you can go on a site like psychologytoday.com and you can find a therapist through there who lists that they do telehealth and takes your insurance. And they, as long as they have this license called PsyPact, you can be seen by anyone all over the country, which just greatly reduces access.
What specific actionable resources or warm lines are available for Kansans outside of the major metropolitan areas?
Yeah, I'm gonna umbrella that question just a little bit and in general talk about if you can't access or aren't ready to access mental health care, what else is there? And so I think first I just wanted to quickly say I just mentioned accessible mental health services. And so if somebody can't afford care, like they don't have good insurance for mental health, or they can't afford the copays, or they don't have insurance, they could check out other options like their county services. Those are usually based on how much money you make, or sometimes free services. They can see if their insurance or if their work has EAP services or other free programs for mental health care. So then in terms of the warm lines and things like that that you mentioned, so the 988 is national hotline, and that can get you support through tough situations from a trained counselor. Um, the Kansas has a warm line, which is trained peer support, where you have someone to talk to most hours out of the 24 hours that can get you support and connected to resources. That one's a longer phone number. It's a local one, but you can quickly search that online if you type in warm line. Um, and I think finally, I just wanted to mention, I don't really recommend using like Chat GPT for therapy services right now. I think there's a lot of unanswered questions about AI-driven resources like that. But I will say that there are some really wonderful online apps that teach coping skills. My favorite one is strangely called COVID Coach. It's a very outdated name. They're renaming it to Coping Coach, but I guess that rollout is slow. But it's a wonderful free app, COVID Coach, that has just tons of really excellent therapy-based coping strategies and recommendations that people can use for free, which I think is really wonderful.
All right, thank you so much. This is Sunny Serotonin. We'll see you in the next episode.